Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlan Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. All right, we are glad to have you with us today. Harlan Pickett, Health and Wealth Power Hour. Thank you so much for joining along with us on this Thursday. We're pretty excited today that in the studio with us we have some lovely young ladies. Hey, it's always great to have you lovely young ladies in the studio. As look, there's Gary Knight. He's like, he's giving me the thumbs up over there, having lovely ladies.
Right.
Yeah. But we have some ladies from the Gulf Coast Regional Blood Center here that's going to tell you about what's going on, not just in this year, but in next year, and how you can participate. And most of all, how desperate a situation it can be this time of year when people are not thinking about those donations that they do the rest of the year. All right, we are very blessed today to have Rebecca and Carol with Gulf Coast Regional Blood Center, the Blood Center, as it were, with us today. Met you ladies a few months ago at a health and business fair, and we hit it off. We tried to get you on the radio that day, but your schedule didn't allow, but here you are.
Yes. Yeah, thanks for having us. We definitely want to talk about the need for blood this holiday season. As most people know, during the holidays, you want to spend time with your loved ones and be with as many people as you can. But unfortunately, the reality is patients, they're going to be in the hospital. A lot of times doctors want to give those patients a chance to go home for the holidays. So they will have them do several transfusions. They can go home for a couple of days. But if there's no blood on the shelves, the doctors can't order those treatments. So we want to talk about that and kind of do a call to action and make sure everyone knows the importance of giving blood during the holidays.
Yeah, that is very important. I want to point out something because I'm on the insurance side. It is an interesting thing that I look at things a little differently too. So imagine that you would like to get your surgery done in December because you know your deductible is going to reset next year, so you want to go ahead and get it in, but you can't have that done because there is no blood on the standby. Because even if you may not need it for your surgery, they always have to have some on the standby just in case.
Absolutely.
So they will postpone your surgery, and now you're in the January, February time of getting this done.
Right.
And guess what? Deductibles do again, right?
Yeah, no, you're right. And another thing that a lot of people don't think about is sometimes if there is a shortage of blood, doctors have to make very hard decisions sometimes.
Yeah.
And we never want to put families or doctors in that situation. So that's why we really want to make sure that everyone knows that while we do want you to enjoy your holidays, be with your loved ones, take off of work. We know that, it's time to reset and get ready for the new year. We still need you to come out and donate. So we need as much as we can. We have to collect 1,000 units every single day. That number does not go down during the holidays. So it's very important to come out. We have several blood drives throughout the entire Gulf Coast that you can go to. We also have fixed neighborhood donor centers that are open very extended hours during the holiday season. So there's no excuse not to get out to donate.
Yeah, absolutely. There's a lot of family gatherings during this time. There's a lot of holiday parties.
Yes.
Why not have a holiday party where you all go and give blood and then go have your big meal? Because that's what you're supposed to do afterwards, right? You're supposed to have a hearty meal afterwards.
And before. A lot of people have the misconception, right. When you go to a doctor's office to get blood drawn, they tell you fast, don't eat. We're the complete opposite. Right. We want you to go have that big steak meal with the baked potato, all the leafy vegetables and greens, then come and see us, and then you can eat some more afterwards.
Yeah, make sure you get plenty of iron, right?
Yes, lots of iron.
You want that blood drop doing the right thing
That's
whenever
right.
it gets put in the deal. I guess y'all still do that, right?
We do. We have to make sure you have enough iron in your blood to donate. So you will get a little prick before then.
Oh, actually, no, we got rid of the prick.
right,
Remember,
we
we have a new little thumb. It's like a blood pressure tester they put on your thumb.
Okay.
And so we don't. I know sometimes that finger prick is the worst because
It is. It hurts more than the rest of it.
Exactly. So we did get rid of that, and we're doing a less painless way of figuring out how your iron levels are.
All right.
Yeah.
That's good. That's good.
Excuses.
No excuses.
Well, and it is. It was always the part that I hated the most.
Yeah.
Is that particular thing. Now I do the platelets thing, so
Yes.
that's a whole different deal.
different deal.
You get to sit in a chair and hang out for a little
Watch
while.
some TV,
and-
listen to music or podcast or radio.
Right. There you go. Yeah. No, I mean, who wants to listen to radio? Oh.
Oh, no.
Well, so tell me a little bit about what you actually do. So here you are, you're talking about this, but you don't get to sit on the radio every day and talk about this, Rebecca. So what do you actually do?
So my position is an account manager. So we have about 15 actual account managers. And what we do is we go out into the community and we look for host groups. Our host groups can be churches, they can be businesses, high schools, community blood drives. If you have a place that we can have access to a restroom, we can make it happen. We do inside setup. So if you have a conference room or a break room or any open fellowship hall at a church, we will come and set up inside. Or if you just don't have that or you're not willing to let us come in, it's okay. We have those big donor coaches. I'm sure people have seen them driving up and down the highways because they get a lot of mileage because they're pretty much used every single day. We have 10 that we use and send out every single day. So if you do have that, we would love to, contact us and let us know. We would love to have at least 21 committed donors. That's kind of what our standard is. Now, during the holidays, we understand that a lot of your employees or workers are off, but maybe they'll come back in and they'll do that just to check up on some emails, just say hey to everyone. So don't always try to make up an excuse. There's always a way to get people back in the office to have a really cool thing during the holidays. So
Yeah, and you think about a place that may be, just had this epiphany, a place that may be a great holiday to have one of these, and that's church. A lot of people go to church around the holidays when they may not go any other time of the year. But if you're a church, you could have people show up at your services and therefore have potential donors that you may not have any other time of year, and could really increase the numbers quite a bit, because that's not a place people are just going away from because of the holidays.
Correct. Yeah. Our Sunday, our churches, during COVID, it really hit us hard because, as anything, everyone was told to stay at home.
Right.
But we're over here yelling, wait, we need y'all to come out and donate. So, as COVID has slowly kind of disappeared, churches are back in full swing. We are seeing a huge uptick in our churches and the donors that are coming back. So yeah, we're going to definitely hit the churches hard this December, this January. But yeah, come out to your church. We usually try and do the blood drive so it hits all services. So if your service starts at 8:00, we'll get there at 7. You'll have that hour before the church service to donate. You can still go to the church service, then come home. So we try to make it as easy as possible for people to donate blood, because it's the least that we can do. They're saving several lives with each donation. Right. So 1 hour out of your day is not that big of a deal.
No, it really isn't. And so, Carol, I'm going to get you to chime in here. I told you guys I wouldn't ask any tough questions, but this one might be. Where is a location or a business or whatever that people may not think traditionally is a good place to have a blood drive, but you guys have found is an excellent place to have one?
A good example, Centerpoint Energy. They host Houston community-wide blood drives.
Okay.
And you'd think, maybe a lot of their linemen are going out and working, but hey, so we can't really get them committed to like a certain appointment spot. But then we're just like, okay, just come when you can. Come in, donate, and then you can go about your day. But, that's a busy business, obviously, and they do great blood drives. They fill up their sign-up sheets, and they always hit their goal, more than 21 donors sometimes. Sure. And they've been a great community partner helping us get the blood on the shelves. So
okay, so let's talk about an event like what we had for that health and business fair. Mm-hmm. That was actually sponsored by the Fulshire Katy Area Chamber of Commerce. Was one. So a Chamber of Commerce
is also not something you traditionally would think of, but events that they have, even say certain meetings. Some of them have monthly meetings at different places. Those type things may also be a good pull for the community, not just the membership, but the community, if it's actually put out there and promoted properly.
Yeah, and that's kind of how we got going with in Fulshire area. There's a Parkway Fellowship. It's a very well-known church there. They weren't able to host on Sundays just because of COVID and other reasons. So we actually joined with the chamber because that's where their meetings are held.
Right.
So we're actually having a January blood drive. It's going to be during their meeting, so it's actually there. So if you want to come and do a meet and greet with new businesses, new people, and then go give blood. So like I said, we try to make it so easy. And yeah, chambers have been a huge asset to us, not only for blood drives, but just to spread the word.
Right.
I've been contacted so many times. And when we don't have a blood drive, they're like, well, can you at least come talk to us and be our keynote speaker? And we love to do that because a lot of times people have more questions than answers for us. And so we want to just provide that education and let them know that, hey, giving blood is a really easy thing to do. And by the time I'm done with them, talking to them, they're like, man, I thought it was so much worse than that. And it's really not. So.
Yeah, as you mentioned earlier, there can even be some comic relief because you get to read the questions.
Yes.
And
we get the questions. We get the questions. But we're always happy to answer them. So to always never think that any question is, too dumb or stupid because I've been doing this for 12 years. So I've heard pretty much every question under the sun. So keep them coming.
All right. So on that event, the interesting thing about that particular event is it was a health and wellness fair. Mm-hmm. And I don't think you guys, maybe I'm wrong here. Did y'all take any appointments beforehand?
We did.
Okay.
So a part of that, too, is we have a really neat marketing campaign that we use for pretty much all of our blood drives. If it's open to the public, we're going to do our part in spreading the word.
Okay.
So don't be afraid that if you're like, well, how am I going to get the word out? We have several tools. So the way we marketed that blood drive is we have zip codes. And so we will pull emails of our best donors that maybe are eligible. We'll send them an email saying, hey, you're eligible to donate. Why don't you come here? So that's kind of the majority of our signups were from our email blast.
Okay.
And obviously the chamber sent out several reminders. We send out a link that all they have to just click on it and it goes right to the schedule. And then we do get walk-ins. They're very rare. But a lot of times people count on walk-ins. Don't.
Yeah.
A lot of people like to prepare for their donation. So them just walking by and saying, yeah, I'll donate. It's very rare. Now it does happen, but we encourage signups for so many reasons. But that's mostly how we do our advertising for that.
All right. That's great. And a lot of folks don't know this particular part of it, but at that event and in a number of other events, if you show up and maybe you didn't sign up and you were thinking about being a walk-in, there is a chance that you could be pulled into Spider-Man's web or you could be lassoed by Wonder Woman. There's no telling what could happen to you. And then all of a sudden you're donating blood.
That's right.
You're asking how this could happen? Well, stay tuned after this break. We'll give you all that kind of information. Harlan Pickett, Health and Wealth Power Hour. Be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. No refugees in here today. We are extremely blessed to have Rebecca and Carol with Gulf Coast Regional Blood Center, the blood center, with us today, talking about what is always a shortage of blood during the holiday season. One of the things that we hit on right away was the tough decisions that doctors sometimes have to make during this time of year. And a lot of times, of course, families can be very put out, very disoriented and discomfort and all that because of decisions that are made that they can't understand why it would occur, why certain surgeries and such can't occur. And one of the things that must happen is, of course, in some cases you have to have blood for the surgery that it's going to be needed during the surgery. But there is another side that people don't see, and that is they must have blood on hand in case of emergencies during surgeries also. And if there is not a surplus of that blood there, then your surgery will not happen. There's a lot that goes into it behind the scenes that people simply don't see. And the slowdown of donations this time of year because of people taking off, because of people not thinking down that road, they're thinking of course, celebrating with families, is one of the big issues that the Blood Center runs into every single year. But I mentioned before the break that at the Fulshire Katy Area Chamber of Commerce Business and Health Expo, that walking around roping people or lassoing people into donations, as it were Spider-Man and Wonder Woman. Well, we just happen to have our version of Wonder Woman here with us today, and that is Carol. Carol, thank you so much for what you do. And you weren't just there, you were there supporting the Blood Center, and that's who you work for. But you also have a super cool thing you do on the side. So tell us about that.
Yes. So in my spare time, I do volunteer my time with Multiverse Cosplay organization. And cosplay is spelled like, a good cause. So C-A-U-S. It's kind of a little play on words. So we're a group of volunteers, and we dress up as superheroes, Disney princesses, Star Wars characters, and even villains. And we volunteer time with charities, nonprofits, organizations like that. So I do work for the Blood Center, and we were trying to garner a little bit more attention, trying to get more walk-ins since they are rare, try to get, lasso people in, just to kind of call attention to the need and bring awareness, which is something that Multiverse Cosplay organization does, is try to bring awareness to the different organizations that we volunteer time for.
Yeah, absolutely. I have, since that event, we became friends on Facebook. We've exchanged, text and emails and such, and I've seen so many different places you've been, all the way from, as you talked about, centers for the aged, for orphanage type areas or places that take care of kids, just all across the spectrum. So it's not just working with the Blood Center, which Correct. I know is very near and dear to your heart, obviously, because you work for them too. Yeah. But it's across all spectrums, and it's across all different kind of businesses that have supported that.
Correct.
And it is awesome because, when I met you, you were just Wonder Woman. But then all of a sudden I'm like, what? That's the same person, because you didn't even hardly look the same. All of a sudden, you got a blue dress on. I don't even know who you're supposed to be in that. You're
Belle.
Okay.
Yeah. That's Village Belle.
Yeah.
Village
but we
Belle.
do have a Princess
yes,
Belle
okay.
in the big yellow dress.
Yellow dress. Okay, so that's why I missed it. Okay.
Yes.
All right, I forgot about Village Belle.
I had Chip with me.
Yeah, okay.
Yeah.
Okay.
But I personally do Wonder Woman, Village Belle, and then Maleficent from Sleeping Beauty. But we have, so depending on the event, obviously we want to get as many volunteers as possible. So we try to share costumes. So we have another Wonder Woman who does the Liz Carter version.
Okay.
Linda
Yeah,
Carter,
Linda
I'm so
Carter.
sorry.
Yeah.
And then
The one I grew up with.
Yeah. So we actually had a request come in for Linda Carter. We went out to Brookwood community for their holiday party. So I was like, hey, we'll tag team. You do Linda Carter, because I had previously gone as Wonder Woman. And then we got a request for Belle. So I was like, I'll go as Belle. And we had Wolverine out, and the residents there are just... that's one of my favorites. They are just so full of love. All they want to do is hug you, take selfies. So that was a wonderful event. But yeah, we've worked with memory care facilities because adults love us too. It's not just children. We do work with. We've gone to Ronald McDonald House. Yeah. But the adults love us just as much.
Oh, you're not joking about that. That one of the things that we were talking about earlier is when we were out at that business and health fair. Is I became a photographer for quite a while, though. We were standing there talking, and all of a sudden I became the photographer because all these adults were coming by wanting to take pictures with you and Spider-Man. And so I became, and most of the time, actually, he got kind of kicked to the side because everyone wanted to take a picture with Wonder Woman, okay? But it was really funny. So some of the comments that I got after the fact, because we put all that stuff out there, is, oh my gosh, you rock. Look, you brought together Marvel and DC.
Yes. Yeah. We get, that's so funny because kids, they're like, well, what are you guys doing? And I'm like,
sorry.
It's multi-universe, right? Like that's the name
Right.
of the group. So yeah, but those kids, they're so fun. And I love it when they really get into it, and then but they sometimes get scared, like even if you're Wonder Woman or Belle, but
Right.
Yeah.
It's just different, right? Well,
Yeah.
first of all, they're not expecting that to be in person.
yeah.
Right.
Yeah.
It
see
really
what-
doesn't matter what it is. That they're not expecting that in person, and when it is, this isn't right. This
Yeah.
isn't normal. This isn't. Yeah, this is not what I expected. So they got to kind of get over
Yeah.
that. Speaking of that, people giving blood kind of think the same way, right, Rebecca? This isn't
Absolutely.
right. This isn't normal.
Yeah,
They got to get over that.
You'll get over it real quick. Yeah, those first time donors, and speaking to that point, if you are on the fence about giving blood and you know it's the right thing to do, but you have some fears, of which we totally understand.
Right.
We really encourage our first time donors to let our staff know. They process so many donors throughout the day, throughout the week that sometimes they forget that there are new donors.
Right.
So please don't be afraid to let them know, like, hey, look, I'm really scared. I'm really, really dreading this, but I know I'm doing this for the good cause. And they will take extra good care of you. And then we want your first donation to be a lasting impression that, hey, this isn't so bad. I can keep doing this. So please let us know that you're a first time donor.
Yeah, and I think that's something a lot of us that have given blood so many times, we all had a first time also.
Exactly.
And I get nervous about it every single time still.
Yeah.
It doesn't mean you get over it. I know some people say, I don't, but there's nothing natural about being stuck with a big old needle. I
Yeah.
mean, there's just
It's not
really-
that big.
When it's going in your arm, it's like the size of a 1-inch pipe.
But the other thing though, our phlebotomists though, they're not like you mentioned lab work, but lab techs, they sometimes just stick you and they don't care.
Right.
But like our phlebotomists are so sweet, so gentle, because they want you to have that good
Right.
experience.
No, I agree
Yeah.
with you. I agree.
Yeah.
They do a great job.
They
but
do.
It is. I sit there and I just can't watch it happen.
Oh, me neither.
I just
oh,
can't
look
watch
away.
I
it
work
because
for the
it
blood
is.
center.
It's a 1-inch pipe they're sticking in
Yeah.
my arm. That's what I'm seeing.
Oh, no.
No, stop laughing at me, Rebecca. That's still
Don't-
to this
don't
day
watch.
after
I don't
all
watch.
of the times that I've given,
Yeah.
that it's still. I'm like, no, I can't watch this.
And it's
And that's
not
okay.
Yeah, it's not a natural process to see a needle in your arm, and then the blood coming out right there in a bag.
Right.
I mean, that's not natural. But we just say, just try it once, and if you like it, come back. If you don't, then recruit someone to do it for you.
Exactly. And sometimes we'll give you like a free prize. Like
That's right.
Right now we're doing, you can pick your own prize.
Yep.
T-shirts, towels, socks. But then towards the end of the month, the last 2 weeks is really hard for us because of the holidays.
Right.
We're actually giving away free hoodies.
Yes.
wow.
Nice ones.
They're
Like,
nice. Yeah, really
Yes.
pretty color too. So and that's a
Aquamarine.
Oh,
I
think
thought you were going to say blood red.
no. Well, yeah.
I was
Maybe
gonna say
next
cobalt.
year. Yeah, maybe next year. We're trying to figure out the color, but it's
But it's
more,
really
It's really
nice.
pretty. Yeah.
Yeah.
So if nothing else, come for the hoodie.
Yes.
There you go. All right. Yeah. So I have a kind of an interesting question. I remember because my mom is kind of borderline anemic.
Sure.
I know that there's a lot of times that she got rejected.
Absolutely.
She pretty much every time she was eligible, she would do it. What is, maybe you don't even know this, what is the rate? What is the rejection rate? What is the, and for whatever reason, sometimes I know it could be that, but it can be other reasons too. What is the rate of people that are denied the opportunity?
Yeah, so we see mostly with our high school donations, we account for about a 20% deferral rate,
Okay.
just because they're young donors, their iron's not tip-top shape. As you can imagine.
Not a bunch of leafy vegetables.
That's right. That's right. Snickers and Cokes, pretty much. But for our adults, we see a little bit lower than that. But what I do want to say is for the women that are listening, our medical director has really encouraged us to spread the word about taking an iron supplement.
Okay.
Women's iron levels fluctuate a whole lot more than men's.
Right.
So a woman could donate 3 times in a row and have great iron, and that 4th time she comes in and it's drastically lower. Nothing that she did on her part. It's just the bodies are different. So if you do want to become a lifelong donor as a woman, and even men too, if you have naturally low iron, we really encourage you to take those iron iron supplements. That's what mostly accounts for our deferrals. Now, if you're sick and you're not feeling well, don't come and donate. But I mean, we do get those deferrals. And but if you do have a question about, don't self-defer. Don't say because I'm this, I can't, or because I have this, I can't.
Or you take a medication.
That's right.
Right.
You would be very surprised to learn that we actually can. A lot of donors that do think that they can't donate, they actually can. So go to our website, check it out, see if you can donate, or even just come to the blood drive. It's no harm in coming and asking questions.
Like, I know a lot of diabetics are like, hey, I can't donate. Hey, if it's controlled and you feel great, come in and donate.
Absolutely.
Yeah, and I think that's one of the things. There are some medications, clearly.
Sure.
But if they can't find the information that's definitive on the website, they can call also, right? You don't have to come out to the blood drive. You can call. You can get a live person.
You do. Yes, you can get a live person. We can talk you through it. So, don't ever be scared. We're very friendly, and we want you to come to our blood drive.
Certainly. I mean, why you wouldn't want someone that was putting people off if that wasn't the case. So, obviously, you want the phlebotomist to be very good at what they do, very gentle.
You know, we're the vampires of Houston, but we're nice vampires.
You're the good ones. And you come out at day.
We come out at day.
So you can tell you're good if you're out at day. Right?
Yeah, exactly. That's true.
All right. It is time for our last break. And when we come back, we're going to get a little bit more information about these guys and how you can get them out to your facility to take care of business. Harlan Pickett, Health and Well Power Hour. Be right back. And this is Harlan Pickett, Health and Well Power Hour. Thank you for being with us today. We are extremely blessed to have Rebecca and Carol in from Gulf Coast Regional Blood Center today. It has been great getting all the information from you guys, and we know that it is just such an important time of year for folks to continue to give. You mentioned that in January there's going to be one from the Chamber. I want to get a little more information on that because I'm guessing that is going to be on their regular morning meetings that they have, right?
Correct.
Okay.
Yes, a Parkway Fellowship.
That is the second Wednesday of January then.
That's right. And we start super early. So if you want to come before you start mingling with other businesses or meeting new people, come and donate. It's inside the church, so it's super easy. And then stick around for the meeting. I know they always have a great breakfast. So if anything, just go get a breakfast and donate blood.
Yeah. You won't have to worry about getting a hearty meal afterwards because we'll have a really good breakfast on that morning.
That's right.
Who knows what kind of cool, maybe you'll have some leftover sweatshirts then or some leftover hoodies.
I think it's T-shirts.
Yeah, T-shirts. You're going to get something.
Yeah.
You'll get something.
You'll get something.
That's right. And not only that, you'll get to hang out with really cool people.
That's right.
From the Chamber, because that is, as Don McCoy likes to say, the fun chamber.
Yes.
And it is. We've been a member with Eagle Care. We've been a member for a couple of years, and we have a lot of fun hanging out with those guys.
Yes.
So I look forward to seeing y'all then, too,
Absolutely.
because we'll certainly be there. And, of course, we do have the December Chamber meeting that will be next week. That is on next Wednesday, the 14th. That's going to be there at Parkway Fellowship. It is the Parkway Fellowship in Richmond. Do not go to the Parkway Fellowship in Katy. If you do, you will be very lonely.
Yes.
You will not see us. You will be sitting in a parking lot saying, why am I the only one here? It has happened before.
I'm sure.
We had a state senator that was coming to speak for us a couple of months ago, and she was wondering if she got there the wrong day.
Oh, no.
No, you got there to the wrong place.
Oh. Poor thing.
It happens. It's funny. Then you look at your thing, you're like, oh, Richmond, Texas.
Yes. Very different.
Not Katy, Texas.
No, not Katy, Texas. Very different.
So for the folks that have been out there listening to this and they really want to, hopefully they are willing to help fill up the cabinet, as it were, for now. But if they can't, if for whatever reason this is not a good time for their business or their organization or whatever to do it, but they want to get on the calendar for next year, we highly recommend you do that, folks. There's absolutely zero things wrong with doing it. It can only help enhance your business. It can only help enhance your notoriety in your community, because I don't care if you just got 10 employees. That's right. The folks in your area are going to know about it because the Blood Center is going to make sure that. Think about the free publicity you're getting by having this at your business, and now there's people from all around your community coming and finding out that you even exist.
Yes. Well, and the cool thing is too, it is completely free to your company. We do not charge you, and we actually bring snacks. So we do everything. So all that we really ask you to do is to promote the blood drive. Get us some donors to commit to their appointment. We do marketing material for you. We'll put your logo on the flyers. I mean, we try to make it as simple as possible. So if you can't do it the last, in December, we understand, but we are always booking ahead. We love to have those dates for your company on the books. So go to our website. It's giveblood.org. We have a whole landing page about hosting a blood drive, and you'll just fill out a few questions, and then we will put you in contact with your recruiter, and then they will take you through the steps of how to host a successful blood drive. So giveblood.org. No business is too small. No business is too big. If you want to do it, we'd love to have you.
And one of the things that we want to point out one more time, folks, is if you say, well, yeah, but we don't have the space, they have the space for you.
Yes.
You get the cool RV, the big blood RVs coming out there doing the thing. So now imagine that you've got this smaller space for your 10, 15 employees in a strip center, but now you get the big blood RV out there.
Yes.
I mean, you can have a whole event out there, sit yourself up some tents, let everyone know you're there. Promote as a big community event.
Yes.
Think about it. You got a small coffee shop. You got these different things. The blood center is there to help you help them. How about that?
I like that. Well, I love that.
Yeah.
And we will. I mean, we just need about 8 to 10 parking spaces, which is really not that much. But, we'll be there, and just get us the donors, and we'll have a good time. So.
Yeah, absolutely. And, if you play your cards right, maybe Wonder Woman will show up too. But you don't have to have a blood drive for that. You can be involved in a number of other charities and organizations and different things that you would love to have. Some of the you can have, like we said, Marvel and DC. Yep. The battle can be right there in your parking lot, right? No, really, you can have folks come out there and surprise the kids, even surprise the adults, because as we talked about, the adults are just as goo-goo over it as the kids are. But how can they get in touch with you guys and even learn more about what you do?
So we have a Facebook page, Multiverse Cosplay Organization. Like I mentioned, the cosplay is spelled like a good cause. Right. And we're on Facebook and Instagram. You can see photos of a lot of the events that we've done. And we work with nonprofits, charities. If you're hosting like a charity event, like you want to raise money for some good cause, and you think it'd be a good fit for us, that's something to think about as a business. And then like if you've got like an auction item, we can always work out like an auction item where we can offer our services up to help you raise money. We've worked with, like I mentioned, memory care facilities, just because they need a little joy in their day.
Yeah.
So visiting, if you've got like a residential, facility for the retired community, and you have like a Halloween party, anything like that, we'd love to be a part of that and bring some joy to the day, brighten some lives. So let us know. You can message us on there. We also have an email address on our about page where you can email us, but we look forward to making people smile.
And that is it is something. When you see your childhood heroes, it does. It just makes you smile, right? That's one of the cool things. I think that is why the movies do so well.
Oh,
right?
yes.
Is we all watched typically the animated version, or we read the comic books, or both. And so now all of a sudden something's jumped off a page or off a screen, and it's right there with you, and it's like, what is going on? You can't help but smile, right?
That's right.
But it's interesting, and I really commend you guys for what you do out there, because it is a volunteer thing.
Yes.
I was shocked when I found out that that's really what you guys do, is you're donating your time for some good causes. Thus the name Cosplay, guys.
Yeah.
So it's the CAUSE. So Multiverse Cosplay Organization.
Correct.
Right?
Yes.
Okay. And so go out there. You can find them on Facebook. Once again, I think you'll be shocked when you go through the pictures and see the diversity of the places and the people that they have been and how they help. And, Carol, it's easy to see your heart in doing that, because I can see your heart in working with the Blood Center too. And no doubt you too, Rebecca, because you said you've been there for 12 years.
12 years, yes.
It is a labor of love.
It is, yeah. It's a lot of long nights, long days. But the end goal and what we always say is that we are in this to save lives.
Right.
We have bad days just like everyone else, but we can go home every night and say, my work impacted families. So that's what really keeps us going.
Yes.
I mean, we've met several patients, and it just touches your heart to know that you had a part in that child still being alive.
Yeah.
So it's a really cool job. We love what we do, and we love what we do, and it has a really cool impact on the community as well.
No, and that's just huge.
Yeah,
that's just huge, and it is. And I'm, I feel honored to have met you both.
Absolutely.
And the work that you do, the difference that you make in the community, the businesses that you share your vision with, and the Blood Center's vision with. I think that it takes a special person to do that, and the Blood Center did good in getting y'all.
Well, thank you. We appreciate
thanks.
that.
So-
Yeah, we love our jobs. It's I didn't grow up thinking I was going to be the blood drive lady, but here I am, and I'm loving it. So it's worked out well for both of us.
When you were a little girl, you didn't play blood drive?
I didn't. I didn't do that.
Our director
so-
always says that.
Yeah, he
but
does.
here we are.
But here we are. Best job in the world.
Oh, yes, other people are playing school teacher or doctor or
Doctor,
whatever. No, I'm playing blood drive.
Yeah,
over
we
here,
have
right?
blood drawing here and there.
Well, at the end of the day, it's just another sales job.
It is.
It kind of is, yeah.
It
It's crazy to think about, but
It
we have to convince
we have numbers.
you.
Yeah, we have to
Yeah.
convince you, and we have quota that we have to meet as
Sure.
well. So I mean,
Sure.
it's a tough job, but like I said, the end result is just so worth it. We get to meet several patients, and some of the stories don't end so
stories,
well.
yeah.
But most of them do, and just to hear the dads and the moms that come in and talk about their kids that they are alive today because of blood donors, that really tugs at your heartstrings. So like I said, we have bad days, but at the end of the day, knowing that what we do really impacts families and specific people, it's worth it.
Yeah. And on that note, we do a lot of Replenish the Need drives, and that's where we host a blood drive in honor of a patient.
Right,
So
right.
that's something else to think about. A lot of, fortunately, people don't get the need for blood because they don't have an experience with I don't know anybody that's used blood. I haven't used blood. So a replenishment drive kind of puts a face to the need. So they're like, oh, I didn't know my neighbor needed it, or my coworker's kid needed it. So it's just to bring awareness, and then that motivates people to then donate, because then they understand and they'll be like, oh my gosh, maybe one day I might need blood, and I'm glad it's on the shelf.
Yeah.
Yeah, absolutely. And I would guess, this is totally a guess, that if you maybe have lost someone, you can also do
Yes.
one in their honor.
Absolutely.
Yes.
We do that all the time.
Yeah, we have actually one coming up in Cypress, Brooks Place. It's a barbecue joint. He hosts one for his wife every year, and she passed from cancer. So, and she used blood products. So
Absolutely.
he's just so sweet, and I love helping.
We
him
love
with
our
it.
people.
Yeah, we do. We connect with them. I mean, they're
Right. All right. Well, guys, I hope that you got something out of this. I hope you realize what the great need is. Reach out. What's that website again, Rebecca?
Giveblood.org.
Giveblood. It just don't get much easier than that.
That's pretty easy.
All right. Hey, thanks, guys. Appreciate you
Thank
being
you.
with us
Thank you.
today. Thank y'all. Hope to have y'all on again sometime.
Absolutely.
All right, guys. Health and Well Power, Harlan Pickett. We are out.